So let's trade places, let you take a turn actually doing one mock patient using the Dentiform. So let's start from scratch. We're at the plain desktop. Go ahead and launch Florida Probe from the desktop icon.
Welcome to the Florida Probe.
And we heard our welcome. I want us to make sure that we hear that.
Right.
We're at our patient lookup screen. Let's start with a new patient. Okay. And we're going to type in last name, first name.
As myself?
Sure. And that's fine.
Okay.
That's all that we need on this page. That was step one according to the step-by-step. Launch and identify the patient. Step two, let's go to the periodontal risk assessment, the heart icon. And you're running through a query with the patient. The value is in the conversation. So let's just click on some items here. Diabetic, never been a smoker. Everybody's got some bruxism, some stress and grinding.
Oh, yeah.
I know I do. Good oral hygiene. And do you have any family history, genetic predisposition
No.
for perio or diabetes? And remember that it is always a function of age.
Okay.
That's right. You need to highlight it, and then that's it. Perfect. We'll click on OK. We'll get the rest of that information from the actual periodontal exam. We now go to patient education. It'll take just a second to launch. Let's blow it up full screen. First time we see this patient, we would click on the individual icon. If I click play, I get all those that are checked. But the individual icon will just play that movie. We're going to go ahead to quit. And now we'll go to perio page. We're telling the computer what is today's exam going to include. For this training portion, I want to leave recession off, MGJ off, but let's please turn diagnosis on. And now your name should be available from the drop-down list. And you click on OK. You're now done with the keyboard and mouse. So you're ready to take out your handpiece.
Okay.
Remember to protect this cable.
Yep.
Put that over your shoulder. Go ahead and pull the foot pedal around where you can work with it. Now think about how you work around the chair. Are you right or left footed? What foot do you use for your rheostat?
I'll use my right.
And when we watch you work, we'll offer you. It depends on where the computer is,
Okay.
where the chair
Right.
is, whether you're right or left-handed. Okay? Go ahead and install it on the encoder cable. Hold the silver, turn the handpiece to snug. Take off the protective cover. Push it against your gloved hand to make sure it's free-floating, not bent or kinked. Is it okay?
Perfect.
All right, let's calibrate. Depress it fully, hold it, step quickly. Nice pause, then release, and step again. Okay. Do you want to record the dentition?
Yes.
Let's say yes with the foot pedal.
Entering missing teeth.
Cursor's where?
Number one.
Number
Right.
one. Let's hold and listen, make it missing.
Missing, missing.
Good. Advance to 3 with quick taps. Make it a crown.
Missing. Implant. Crown, crown.
Quick tap to 5. Make it missing.
Missing, missing.
Advance to 6. Implant.
Missing. Implant.
Great. Advance to 12.
Midline.
And it's missing.
Missing, missing.
15's a crown.
Missing. Implant. Crown,
And 16's impacted.
Missing. Implant. Crown. Impacted, impacted.
Excellent. Quick review. Are you confident with the upper arch?
Yes.
Advance.
Lower arch.
So we've advanced to the lower arch. Let's make 17 missing.
Missing, missing.
And advance to 18. Let's build a bridge.
Missing. Implant. Crown. Bridge.
Let go it when we heard bridge. The abutment is highlighted. Select it with your center pedal.
Abutment.
Side pedals move the cursor. So highlight the Pontic, and one goes one way, one goes the other. Select the Pontic,
Pontic.
highlight the abutment, select it,
Abutment.
and highlight the check mark Done. Perfect. Cursor's on 21. Let's make it missing.
Missing. Missing.
28 is missing.
Midline. Missing. Missing.
Let's advance to 29 and we'll build a cantilever bridge, starting with
Missing. Implant.
the Pontic.
Crown. Bridge.
Again, we're going to use our imagination. Whatever the patient presents with is how we're going to build it. So we're going to do a cantilever, one Pontic and two abutments.
Pontic. Abutment. Abutment.
Perfect. 32 is missing.
Missing. Missing.
Okay. Quick review. Confident that you've recorded the dentition correctly.
Yes.
Let's advance.
Entering pocket depth.
Advance to the next mode. The cursor's where?
Number 2.
Distal buckle of
Distal
2.
buckle of 2.
On the buckle aspect. That's where we're going to start probing.
Okay. So we're missing 1 and 2.
So we've made our first mistake.
Right.
We need to correct it or we're not going to be on track during the exam. So what can we do? We're out of the mode, so we can't fix it with the foot pedal.
So quick.
Cursor's
the
on
instrument,
2.
yeah.
Use the butt end of the instrument. Hit the delete key, which is the keyboard shortcut.
Missing.
Perfect. Now you just held it too long. Hit it one more time.
Missing.
Because it put it back in.
Okay.
Now advance your cursor with the foot pedal. You're on the distal buckle of 3, and we start probing.
Okay.
So we insert the tip, contact the free gingival margin, and step.
2.
Next site.
2. 2. 1. Danger. 8.
Made the first mistake. Just step too early. Let's undo. And reprobe, making sure that you're in contact with the margin.
Okay.
Cursor's on the straight buckle of 4.
1.
Excellent.
2. 2. 2. 1.
Let's take a second and talk about what contact means. Okay? This is visual acuity. I accept wholeheartedly that you're used to probing to tactile feedback. You're used to that traditional probe feeding back to your hands. That's gone with this instrument. It is 15 grams. So that's a little more getting used to in holding that handpiece. When we have a really good tight pocket, we know exactly where to stop that sleeve in contact with the margin. When we have a big, floppy, diseased pocket, we need to stop that sleeve at the same plane, which is where you took the measurement with the traditional probe. It's visual acuity to stop there. If you probe and try to get that tactile sense back out of this probe, it comes from pushing on the free gingival margin with the sleeve of the handpiece. If I'm blanching or pushing on the margin, then I'm in effect making the pocket shallower. So it is visual acuity.
Right.
You need to make sure that you can see it. You wear loops.
Yes.
That's a real good practice, not only for this, but your own ergonomics, because I'm
Right.
sure you've learned already. Okay? So we have probed the mesial of 6. It will auto advance to the distal of 7.
1. 2. Warning. 4.
And that site's bleeding.
Bleeding.
Good. We'll advance distal 8.
3. Danger. 6. 2. 2. Midline.
Now notice it enunciated midline after you crossed the midline. It's not that I've approached it. It means I have crossed it and entered the first site in order to keep you on track. It's a little different. Let's pause here for just a second because we had some delayed bleeding at that danger site on the buckle of 8. How are we going to do that?
Moving mode.
Moving mode. Hold red pedal.
You are in the moving mode.
Use your side pedals to put the cursor on the aspect you want. Think of it as forward and back, not right and left. Buckle of 8. Center pedal puts you back into the mode.
Entering pocket depth.
Now you can quick tap record your bleeding
Bleeding.
and use the center pedal to advance
Midline.
without changing data. Go ahead on to your next site and you would resume probing.
2. 2. 2. 3.
Let's talk about one last thing while we're still within pocket depth. The 3 important factors relative to patient comfort. The first one is bent or kinked tip. Make sure it's free floating. I might want to check that during the exam. If something feels a little different in my hand, I might want to check that. A good technique is to keep a cup of minty mouthwash in your tray setup. It's a good lubricant. Sometimes saliva, blood can dry on that and impede the travel of it. So a minty mouthwash in your tray setup. Second one is finger placement. Don't put your finger on the blue button or interfere with the travel of that arm. The third one is angulation. And we've done a specific talk about that we want to, especially on the anteriors, we want to increase our angulation and let the tip slide down the root surface to the bottom of the pocket. If I'm too vertical, then I'm poking the patient. Sometimes we also have to change our angle of attack a little bit. This is an oversimplification, but I can't contact this margin because that occlusal surface stopped me. I need to be in contact with the free gingival margin, so I need to change the way I approach. Same thing can happen on some of these long anteriors. So I want to change the way I get there. Sometimes it's not quite so obvious. Even though I'm here, I'm being stopped by the incisal edge of those anteriors. So I just need to be mindful that I have to be in contact with the margin. I'm going to move us on. Do you have any questions about pocket
No.
depth? Feeling pretty comfortable?
Yes.
Okay, we are at the end of the mode. Stretch, let the patient close their jaw. Everything all right? Let's quick tap advance with the foot pedal. We know that we had some zeros, so we'll say no.
Upper arch. Furcation.
And it went into the next mode, in this case, furcation. Quick taps advance.
Midline.
Advance to 15. Oh, we advanced beyond it onto the lingual. We have two choices. We can use the undo button because it recorded a 0, or we can go into the moving mode. Let's go to undo. We're on the buckle of 15. The software knows it needs a multi-rooted tooth. It knows 2 sites buckle or lingual. Let's do a class 2 by holding and listening.
1, 2.
Class 1,
1,
class 3.
1, 2, 3.
Let's advance to the distolingual of 3.
Midline.
And we pause. We confident in the upper arch?
Yes.
Advance.
Lower arch.
We refer to the monitor. Where did the cursor go?
31.
Buckle of 31. Class 1,
1,
class 2.
1. Midline.
We wanted a class 2. We got a class 1. Our undo button works. Quick tap and make it a class 2.
1, 2.
Good.
Midline.
Class 3.
1, 2, 3.
Advance to the lingual of 31 and pause.
Midline. Upper arch. Black.
Okay. You jumped through it. We wanted to pause. Now, we were okay with that, and that's fine. It's just a good strategy to pause because I can fix it with the foot pedal. If we wanted to make a change right now, we'd have no choice but to go to the keyboard and mouse. We're in the plaque mode. Quick taps advance. Advance to the distal buckle of 4. Hold and listen for plaque.
Black.
Again
Black.
and again.
Black.
Plaque is a real quick mode. As soon as you hear a pluh, release on the foot pedal. Let's advance to 8, distal of 8, and we'll put 3 more sights of plaque on it.
Lack. Midline.
Now we wanted the distal of 8. So let's go into the moving mode.
Okay.
You are in the moving mode.
Move your cursor back to the distal of 8. Center pedal back in mode.
Lack.
Now that time when it said plaque, it was only putting us back into the plaque mode. Hold and listen.
Lack.
Again.
Lack.
Now you'll have to listen for plaque again on this one.
Lack. Midline.
There you go. Very good. So we're at the end of the plaque mode. We pause as part of our strategy. If you're confident, quick tap advance,
Upper arch. Mobility.
and it moved into mobility. Quick taps advance and record a 0. So advance to 7. Record a class 2,
1, 2.
class 1,
1.
class
Midline.
1.
1.
Good. Advance to 15. Confident in the upper arch?
Yes.
Let's advance to the lower.
Lower arch.
Where did the cursor go?
Lingual of 18.
Because mobility is a single aspect. So let's advance to 22. Class 3.
1, 2, 3.
And advance to 31.
Midline.
Okay. Confident with mobility? Let's advance. Now we can select no diagnosis or use the side pedals. Let's use the side pedal to highlight slight periodontitis. Center pedal to select it.
Data collection complete.
Is the exam complete?
Yes.
No. We've got some recession we want to do. And that's part of, remember, some people will actually do this as part of the implementation strategy. They'll turn pocket depth on only, do the pocket depth exam, which includes the dentition, and then when they observe recession, cycle around and turn it on. When they observe furcation involvement, cycle around and turn it on. When they see mobility, cycle on and turn it on. That's another strategy for helping with the time. Okay? So let's say no, we're not done, and use your side pedal to highlight recession.
Upper arch. Recession.
Excellent. On our patient, our first significant recession is where?
Number 3.
Okay, so let's measure 3. We insert the tip, contact the margin, step once, CEJ, step again.
3.
Okay, and it advanced to 4. Recession on 4, measure it.
2.
Excellent. Let's advance over to 11. Quick taps advance and record a 0. And let's measure that big one on 11.
Three.
You're doing great with recession. Let's spend a minute and talk about the ergonomics of the foot pedal. Okay? Let's go ahead and set the model down because we're not going to need it. And I haven't seen you work yet around the chair. And I don't know how much that you move around the chair as you move. But it's important that you take the foot pedal with you as you move around the chair. You want this foot pedal farther away from you than you think. If it's too close up underneath you, your foot and leg is in a bind, and that's very fatiguing. So go ahead and pull that around for your use. Okay. Now, I want you to rest your foot and close your eyes. Just feel that foot pedal.
Lower arch.
Do you see how little movement it really takes? That's going to do a couple things for you. It's going to minimize you moving around to the foot pedal and misstepping, but it's also a lot less fatiguing on your leg over the course of the day. It's going to take some practice, but when you're in the mouth, you don't want to keep looking down to your foot to see where it is, and it's all part of resting in the ergonomics of that foot pedal. Okay? We're at the lower arch on 18. Let's advance to 31.
Midline.
Does that help with the foot pedal?
It does, yes.
Okay. We're at the end of our session. Are you confident? Let's
Confident.
advance.
Data collection complete.
Now is the exam complete? Yes.
Yes.
So we can say yes.
Okay.
It's now saved to the database, took us to our print options. We select what and how many we want to print, defaulted to what we did last time, and we can send it to the printer with the foot pedal, just stepping on the center pedal. And it's gone.
Upper arch. You are in the moving mode.
Did excellent with that patient. Now we can move on and start doing some live patients.
Great.
There are two very special functions within Florida Probe that also help you implement it into the practice. The first one is we provide several forms and letters. There are consent forms, there are press release, there's letters to the patient, and there are insurance narratives for medical necessity as well as describing the various diagnostic codes. You'd simply go to File within the software, the letters and templates, and select the appropriate form. There's a gingivitis consent form, there's a letter regarding heart patients, diabetic patients, pregnant patients, xerostomia patients. The most important one in here is a description for the full periodontal exam, the D0180 code. Why it was a necessity for the patient, what it included, that you will be using the Florida Probe to verify efficacy of treatment, and to explain that this patient presented with periodontal involvement and that you required additional diagnostic information reported separately. The second function that you may find very helpful is if you are doing electronic claims, then I would like the ability to attach the Florida Probe printouts, specifically the graphical chart, to your electronic claims. Just like you would attach a digital image from your intraoral camera or extraoral camera or your digital x-ray. I simply want to convert the Florida Probe printout to a photo image on your hard drive and attach it to whatever electronic claim service you're using. To do that, I go to File, Save Chart as a JPEG image, and I simply need to save it somewhere. And I like to put a folder on the desktop called FP Florida Probe Patient JPEGs. And within that folder, I will name this specific file. And I use a format that's easy to find. So I'll use the patient's last name, first name, and the date of service. So it's easy to reference should I ever need to get to it again. And save it. That picture is now saved in that folder and can be attached to an email, attached to your electronic claims, or sent digitally in any way that you might use it.